So much for your insights, pharmacist Sophia.
You're
I'm
welcome.
very sure our viewers will find your information valuable. All right, so very quickly, let's dive into the second topic, which is sexual health issues. So, pharmacist Chioma, what are some common sexual health problems that one might have as a result of these drug and alcohol combinations?
Tush! Welcome to Mihaj Gospel TV. We love you and we celebrate you.
Okay, right now, because I work in a community pharmacy, and one thing I've observed is people who come in to buy sildenafil. Sildenafil, also known as Viagra, is taken to enhance sexual performance. You understand? It's taken to enhance sexual performance. So both the old, the young, when old people are taking these things, okay, you understand that age is not on their side, and so sustaining an erection is very difficult for them. But seeing young boys buying such drugs, it's something that in fact it's raising an eyebrow. It's something that is causing an alarm. So another sexual health problem is STDs. STDs these days is so rampant. So people need to be more enlightened on the effect of sexually transmitted diseases on their health. Then the use of contraceptive pills. You know, many people don't understand family planning. Many people don't understand contraception. They need to understand it better. They need to attend seminars or go online, read about it, watch videos.
Thank you very much, Ma.
You're welcome.
So, but please, can you explain how drug misuse can affect the sexual function and individual and individual?
How drug misuse can affect the sexual function.
Yes.
The sexual function of an individual. Yes. Well, drug misuse can affect the sexual function of an individual in the sense that the individual, in the sense that drugs have effects.
And so, I'm sorry, let me cut you short. There's something you mentioned earlier when you were talking. You said something like having issues, sustaining an erection, and so on and so forth.
Yes.
So, is that connected to, I think that was, is that connected to
No.
drug? The risk of, I don't know it. I
No,
don't really
it's
get
health.
that.
It's health issues that can make someone not to have sustained erection.
Okay.
Yes.
So, what could lead to that? Can it be drug? Can drug lead to something like that?
Well, drugs can actually lead to something like that. Like now, health conditions such as high blood pressure or stroke, because stroke causes partial paralysis. You understand? And if someone have problem with their testes, it can also cause such problem.
So, tell us, how can it affect sexual function and libido?
Okay, sexual function and libido. Well, it will affect the person's performance, obviously.
So that's the point. So how can, because most young people today, you see them wanting to get high or in the name of wanting to have fun in the place of sex and all that. So how is it now an issue affecting sexual function and libido?
Okay, well, wow. How does it affect libido?
That's right.
That's quite.
All right. So I think our viewers will want to hear that from our pharmacists, so they can be guided. Because I believe that there are risks in taking this drug. A lot of risks, sexual risks in taking drugs. So I think
You mean
one of them
all
is
the drugs or
like the illegal, those ones that you
those
said,
tramadol
just
and
mentioned
the rest?
exactly. So I think one way or the other it can affect sexual
Yes, it can weaken the penile area in the sense that constant, when the person is at a young age, they are very vibrant, strong, and normally a healthy young person is manhood can stand. His manhood is healthy. But when you now come, when someone is already okay and you're still giving the person drugs, there's nothing that drug is actually going to do positively in the health of the person. So with time, these things can actually cause build up in the system, and as a result, the person won't be as active as they used to be in the long run and with time. And then the person will now have to fall back on drugs like the Viagra, as I earlier mentioned, in order to make them active.
Okay, so in
Yes.
other words, drugs can actually lead to low sexual.
Yes, and libido.
All right, so thank you very much. All right, so I think last in our list, how does alcohol and drug misuse contribute to the risk of sexually transmitted infections? How does it contribute to the risk of sexually transmitted infections? You mentioned something like that about sexually transmitted diseases and all that. So how does it contribute to the risk of it?
Yes, this alcohol we're talking about and the drugs we're talking about actually affects the immune system.
Okay.
It affects the immune system, so it makes such an individual to be prone to diseases and infections. Let's say a normal individual has 10% chance of contracting such a who has abused drugs, who has abused alcohol, his chances are like 60-70% because his immune system is already weakened. You understand? So that's one way that they can sustain.
All right, thank you very much, ma. So this is the last. Now, can you please tell us the potential consequences of alcohol and drug misuse on reproductive health, especially for ladies?
Especially for ladies.
Yes.
Okay, number one, it can affect one's womb.
Okay. How? What connection has alcohol, drug with the womb? How?
Yes, this illegal substance, it affects the brain,
Okay.
and then the oral one, that's the one we take orally, can go into the system, causing, it can affect the womb.
Okay.
It can actually affect the womb. It can affect the eggs.
Okay.
Yes, because taking these things for a very long time can actually cause.
Are you saying that it's going to affect some cells, and then when those cells are weak or whatever, then because I don't get the connection between drug and womb.
Well, I mean, okay, it can affect fertility.
Okay.
Yes, it can affect the fertility of a woman. Taking all these drugs too, one effect it has is that it makes someone to age faster than normal.
Okay. Aging faster than normal. I think I'm going with that. Thank you very much. Alright, so is there any other advice you have to give to our viewers out there as we wrap up this section?
Okay, well, drug abuse is bad, drug misuse is bad. Some people don't even understand this drug misuse we're talking about. Drug misuse is not only when you don't take your drugs, it encompasses taking drugs for reasons other than why it was prescribed for you, taking not stopping your medications too soon, not taking your drug at the right time, not taking the right dose. You understand? So this is also part of drug misuse.
Alright, thank you very much. I was going to close here, but you said something that caught my attention. It's very quickly. You talked about stopping your drug, something like that.
Too soon.
Too soon. Now, let's go to the likes of cough syrup. Okay? And if you are giving that kind of drug to take, because the person has cough and then you're asked to take your cough syrup, is the person allowed to stop taking the drugs once the cough stops? Or he or she should continue even after the cough subsided. That is also applicable to other areas of the health as well. Let's say you are having pains and then you go for a prescription and then you are given a drug to take. Are you allowed to stop it once you are no longer feeling that pain, or to continue it even though the pain is no longer there?
Okay, it's dependent on the medication. Like the cough syrup you're talking about, you keep taking them. It's just like saying, okay, you took the first dose of your malaria or typhoid medication and then you feel better and you want to stop taking them. That's definitely not how it should be. Okay. So it depends on the drugs and it depends on what your physician tells you to do. Drugs like, let's take for instance, Flagyl, which is metronidazole and tetracycline. These drugs basically, what they do is that they stop purging. Once you stop purging, you can actually stop taking the drugs. But you see, even also pain reliefs such as diclofenac, ibuprofen, you're not meant to take it more than 3 to 5 days.
Okay.
You understand? So that's the reason why sometimes they tell you, okay, if you're taking these drugs and you've taken it for minimum of 3 days and maximum of 5 days, the pain doesn't stop, consult your doctor. Because what these drugs do is that these drugs like ibuprofen and diclofenac, they are NSAID medication, that's non-steroidal anti-inflammatory drugs. And when you take it for too long, it tends to cause GIT bleeding, that's gastrointestinal tract bleeding. So
Thank you very much. Wow. Thank you very
Yeah.
much. It's actually a privilege. This is your field. So believe you talk and you will talk and talk and talk and talk. That's really very informative. It's a privilege to have you here with us now. We look
You're
forward
welcome.
to having you in the next talk show. Alright guys, thank you for watching. Stay tuned to Miyad Gospel TV talk show for another informative discussion of critical health issues. We love you. Don't forget to subscribe.
yeah.
Hit the notification bell for subsequent posts. Bye.